Emotional disturbance is a high incidence disability. That means it's fairly common, especially among school-aged children. Some of the common symptoms include behavioral or emotional responses that are vastly different from other children their age, especially if it adversely affects their academic or life performance. It's not just a temporary thing. It's consistent, and it has to happen in more than one situation. It can't just be something that's happening at school. It needs to be present in multiple different aspects of their life. And it's not just something that'll go away simply because a student or a child is trying harder to be better. Some common characteristics included in emotional disturbance is the inability to learn that can't be explained. Oftentimes the emotions get in the way and a child won't be able to intake new information. Inability to maintain relationships with others. Again, the emotions get in the way. Inappropriate types of behavior or feelings. This one is more geared toward the norm for that child's age group if they're vastly different than their peers. A general mood of unhappiness or depression that seems to be covering their lives pretty commonly, and also a tendency to develop physical symptoms or fears, including schizophrenia, just when the child acts out for uncontrollable reasons. There's not really a clear-cut definition of emotional disturbance. It's more trained professionals need to look at it and evaluate that child against the norm for other children their age in that same ethnic group to see if they're vastly different and their emotions are causing problems getting in the way of their normal everyday lives. Some classroom challenges that come along with emotional disturbance are the fact that it is a fairly small percentage of students in the United States. It's less than 1% of all students that have emotional disturbance. So while it is fairly common, it's a small percentage, and that means the teacher has to be able to adapt their lesson plans vastly to help not only the normal students but those struggling with emotional disturbance. It can also cause disruptions in class. It is quite common for students to have a meltdown or just be incredibly disruptive to themselves or others, and that can frustrate the classroom. There are mental, behavioral, or perceptual patterns that can cause students to not be able to function properly or to stress them out, which means they won't learn anything. And especially if it gets to the more extreme end, then students may not be able to learn anything at all. They can get to the point where they're so stressed out that they can't intake anything, any new information, which then perpetuates the cycle of lacking social skills being able to, or that are necessary for them to succeed in school, and it may even get to the point where they can't attend school because they're so stressed out and their anxiety is so high. Because emotional disturbance is not a very clear-cut problem, it's different in every situation we find it, there are not a lot of medical advances available to help with it. However, we have seen quite a bit of progress in the prescription medication side of things lately. There are quite a few antidepressants out there to help children be able to control their emotions, and ADHD meds to help them behave properly. However, that might not be the solution for every child. In addition to that, there's also behavioral training where the student and an adult who's been trained to do so can work one-on-one with each other and help the child be able to understand their emotions and control them and learn what's appropriate in certain situations and what to do about it. There are many resources and support organizations out there, depending on each individual's needs who suffers with emotional disturbance. However, there's one organization that kind of covers them all, the whole blanket of emotional disturbance, and that is the American Academy of Child and Adolescent Psychiatry, or AACAP. They deal with not only working one-on-one, helping the individuals that are struggling, but also support for friends and family. Again, because emotional disturbance is such a vast topic, there are a lot of different assistive technologies to be able to help the individual that is struggling. However, it has to be taken on more of a case-by-case basis. For example, there are options to have an iPod or other music player to play music to help calm the classroom or the individual that is stressing out or having an emotional disturbance problem. There's also behavior charts or ways to record points or keep track of different behaviors and other ways to reinforce positive behavior to help the student understand where the problems are and learn how to correct them. Now we've moved into the low incidence disability side of things, specifically that of orthopedic impairment. As you may have guessed, low incidence disability implies that it is not a very common thing, in contrast to a high incidence disability where you might see that a lot more often. Specifically, orthopedic impairment can be anything physically disabling that affects locomotion or motor functions of the body. This could be the result of a disease, an accident, so it could be anywhere from a permanent thing that that individual will struggle with for their entire lives, or something that you were in a car accident and you fractured a bone. As long as it impairs your ability to physically function, that can be termed under orthopedic impairment. While this disability can also have a wide range of ways that it shows up and appears, the list of characteristics are significantly smaller and more clear-cut. For orthopedic impairment, all you need is to limit your locomotive or motor functions. In other words, you can't function with your body the way you should. Some examples of this might be clubfoot, spina bifida, palsy, or any other disability where your body just doesn't function the way it should. The list of classroom challenges for orthopedic impairment could be very far-reaching in a sense that it encompasses every aspect of physical disability. It could be as simple as a student broke their hand and can't write properly for the next few weeks, all the way up to partial to complete paralysis, including difficulties communicating with others, any sort of physical impairment or dysfunction where the student can't move freely to be able to learn or communicate with each other. Because physical or orthopedic impairment is a lot easier to deal with medically than emotional impairments, there are many medical advances that help individuals struggling with these problems. For example, transplantations for help with cartilage damage, ways to fix internal fractures in bones, treatments for muscle spasms for those with cerebral palsy. There's hip and other joint replacements for those that are struggling with joint problems. And these are just a few examples of countless medical options to help those with physical problems. Because physical and orthopedic impairment are often easier to recognize, and very clear cut in their descriptions of what they are. There are many, many resources and support organizations out there for those struggling. Quite often, each impairment will have its own support organization. For example, the National Multiple Sclerosis Society, United Cerebral Palsy, United Spinal Association for those with spinal cord injuries or disorders, and Muscular Dystrophy Association. These are just a few examples of the countless options out there. Each organization is very specific to help those with those particular issues, not only to help those struggling, but also the friends and family and support and research options to be able to make those conditions better over time. Once again, because the physical impairments are so much easier to deal with than emotional impairments, there's a lot of assistive technology that's been developed to help individuals struggling with orthopedic impairment. For example, there's special transportation, wheelchairs, buses that have been adapted to work with wheelchairs or individuals that can't move as well, crutches, prosthetic limbs, support braces. There are countless assistive technologies to be able to help those that can't move very well function as normal as they possibly can and live a fairly good quality of life. In summary, we've talked about just two of many, many disabilities out there. One high incidence, meaning we see it fairly often, and one low incidence where it's not as common in our everyday lives. But we hope that this video has given you the motivation to go out and search more for other disabilities and understand them more, so that we can be more accommodating, more understanding of those individuals that struggle. It's important to plan for that, especially as you prepare to teach, that you understand that there will be individuals that are different from each other, and that we have to do our best to help them learn as much as we can and provide that environment that will support them and bring them up to where they want to be.